Hi, my name is Kunu Kaushal, the founder and CEO of Senior Solutions Home Care. I've not had the privilege of meeting every one of you, but I want to thank you for all the hard work that you've provided to our clients, our families, and our referral sources up to this point. I do want to reassure you during these tough times that we are very much open for business. There's a lot of rumors and misinformation that's happening out there that the situation is very concerning and serious. But as healthcare workers, which we all are, there is a duty to be done, and we want to make sure that we're serving the needs of our clients. Our clients are one of the most at-risk population for this virus. Your close attention and following procedures around hand washing and infection control is more important now than ever. More important than that is you actually coming to work and making sure that you fulfill the schedules that you've been selected for. We only want you to do this if you're healthy. We certainly don't want you to try or attempt to service any client if you're displaying any symptoms or if you're sick. But I want to keep one thing very clear, that although many other industries are shutting down, many other people are winding down during this time, we don't have that luxury. Like hospitals, clinics, and other healthcare providers, there are people relying on us. Our clients are always the ones that tend to be isolated. They are unlikely to have the virus, and we certainly want to protect them from us bringing the virus to them. However, just know the environments that you're going to work in are much safer than at times doing anything socially otherwise. Our clients are looking for you as caregivers to fulfill their care needs, and that can include as little things as just eating, toileting, getting out of bed. These, what sounds like simple care tasks, when an individual relies on you for them, can turn and snowball into bigger issues. The main thing we're trying to avoid is any of our clients getting into worse shape than they're already in. Where they definitely do not need to be is in a hospital setting, an emergency room, or have a paramedic out to see them. Without your help and your support, these things are likely to happen. So please continue to go to work. One thing you should know about the home care industry, recently there's been some information that's gone out that is going to impact many home care providers. These providers that we hope will be exempted from some of these new regulations, it will cause some stress to them. We think and we firmly believe that Senior Solutions Home Care is going to get even more requests and demand for services. As many of you know, facilities, hospitals, rehabs are really taking the elderly population and trying to exit them from those environments where they may be more at risk. Families, out of concern, are also at times staying away from their loved one. They have less engagement, and we are going to be called to fulfill those needs. What I would tell you is other agencies that are too small or maybe not large enough are going to face issues with financial problems and some of the mandates that have been requested by the federal government. We as an agency, as a provider that covers 95 counties in Tennessee and growing areas. We have over 800 employees employed. We are a very large employer with over a decade of experience. Many of these regulations, at least so far, will not apply to us. That really means that where we are not stressed in that area, we will be stressed in others, and that will be a demand for services. Our caregivers calling off is not something that we want to see unless it's something out of your symptoms that you're displaying. We don't want you putting anyone at risk, but we also want to make sure that we're able to fulfill the care needs of our clients. If you would, please make sure that you're engaging with your office, your service supervisor, our HR department, anyone in between at our company. We are very much open for business. Our phone lines are working, our email is working, our scheduling department is still operating. We're still answering the phones 24 hours a day. Make sure that you do go to work, and if for some reason you have symptoms, that you're contacting someone with as much notice as you can so we can be sure to fulfill the schedule as needed for the individual or the client. There's another ask and a last ask that I would have for you as dedicated care professionals that you are. Beyond just following procedure, making sure that you're working safely, the last is we need more individuals entering this workspace than ever. If you have a friend, a neighbor, a relative, someone else who is going through a tough time right now, either temporarily or permanently, they've lost their position or job, now is the time to refer them to work with Senior Solutions Home Care. You can follow anything from steps on our website to learn more about what positions are. You can also just simply call a service supervisor and give them a name and a number. We'd love to talk to an individual. And if nothing else, we would appreciate you bringing them to the office if needed for an open onboarding day. Most of our hiring and training can be done virtually. There's very limited time in which someone has to come on board, and we have the ability to get someone back working and into the field with proper training within 48 hours. We hope that you will not only continue to work, but you'll continue to represent us in the best way possible. Thank you so much for the hard work that you do and will continue to do, and I appreciate you very much representing Senior Solutions Home Care so that we can add years to life and life to years.